These 8 people should be extremely cautious while having turmeric. Turmeric is a yellow spice used in many Indian dishes, but it's not just for flavor. Turmeric has amazing health benefits and has been used in traditional medicine for a long time. The key ingredient in turmeric is called curcumin, which helps reduce inflammation in the body. This can help with things like knee pain, high cholesterol, and even heart problems. However, it's important to be aware that turmeric can sometimes have side effects for some people. Watch this video until the end, because Mr. Clarify will also explore the safe amount of turmeric for everyone. Number 1. Pregnant and breastfeeding women. Turmeric is great for boosting your immune system, but it's important to be cautious during pregnancy. When you use turmeric in your cooking, the amount of the active ingredient, curcumin, is usually low and generally safe. However, taking high doses of turmeric supplements during pregnancy can potentially cause contractions or other complications. Number 2. Infertility. Turmeric might lower testosterone levels in men, which can affect fertility. This means it could make it harder for men to have children. If you're trying to have a baby, it's best to talk to your doctor before using large amounts of turmeric. Number 3. Bleeding disorders. If you have any blood problems, like taking medications that thin your blood, or if you often get nosebleeds, you should be careful with how much turmeric you consume. Too much turmeric can make it harder for your blood to clot, which could increase the risk of bruising or bleeding. Number 4. Diabetes. People with diabetes need to be careful about what they eat to keep their blood sugar levels from going too high or too low. Curcumin, which is found in turmeric, can help lower blood sugar. However, it's important to be cautious when using curcumin, as it can sometimes lower blood sugar too much, which can be dangerous. Number 5. Kidney stone. Kidney stones are formed when minerals and salt build up in your kidneys. One of the most common minerals found in kidney stones is called calcium oxalate. Turmeric also contains oxalate, which can combine with calcium and increase the risk of forming kidney stones. So, if you have a history of kidney stones, it's best to be cautious about how much turmeric you consume. Number 6. When suffering from anemia. Anemia happens when your body doesn't have enough healthy red blood cells. This can be because your body isn't making enough, you're losing too much blood, or your body is destroying red blood cells. If you have anemia, eating too much turmeric might make it harder for your body to absorb iron, which can worsen the problem. Number 7. Liver disease. Some people might worry that turmeric could harm their liver, especially if they already have liver problems like inflammation or a blockage in the bile ducts. If you have any liver issues, it's best to avoid using turmeric. Number 8. Surgery. Turmeric might make it harder for your blood to clot. This means you could bleed more easily during or after surgery. If you have any upcoming surgeries, it's best to stop taking turmeric supplements at least 2 weeks beforehand. The safe amount of turmeric. Scientific research suggests that taking 500 to 2,000 milligrams of turmeric extract daily may offer potential health benefits. Turmeric extract contains a higher concentration of curcumin, the active compound responsible for many of turmeric's benefits, compared to whole turmeric. Consuming 2,000 to 2,500 milligrams of whole turmeric in your food typically provides only 60 to 100 milligrams of curcumin, which is generally safe for everyone. However, if you're considering taking curcumin supplements, it's always a good idea to consult with your doctor first for personalized advice. So, that's it for today's video on who should be cautious about using turmeric. Did you know about all these precautions? Is there anything that surprised you? Let us know in the comments below. We'll be back soon with more health and wellness tips. Stay with us until then. Disclaimer. The information in this article is for general knowledge only and should not be considered medical advice. Always consult with your doctor for any health concerns or before making any decisions about your health.